I'm Shannon.
Yeah.
Yes.
Okay.
Alright.
Shannon too.
My name is Shannon,
And my name is Liz.
and today we're going to be talking to you guys about the influenza and pneumonia. Has anyone got their flu shots yet this year?
Oh, yeah.
Yeah?
Oh, yeah.
Good
Very
job.
good.
Alright, so first I'm going to start out by talking about influenza. I'm talking about it with you guys because it's very prevalent in your population and there's a lot of detrimental effects that can come from it. So some emergency warning signs that alert you that you should go get checked out is difficulty breathing or shortness of breath, pain in your chest, sudden dizziness, confusion, or severe and persistent vomiting. Older adults may develop several other health complications on top of the flu, such as pneumonia, which Liz will be talking about later, bronchitis, asthma flare-ups, heart problems, and ear infections. According to the CDC, at-risk populations include individuals who are 65 years and older, people with weakened immune systems, and people who have chronic illnesses such as asthma, diabetes, or heart disease. The period of communicability is 24 hours before developing symptoms, so this period is especially dangerous because it's the time period where you can infect others. This is a virus, so it is spread through air droplets, so when someone coughs, sneezes, or talks, it's possible that someone else will inhale the droplet particles and contract the flu. For the diagnosis, doctors will assess your signs and symptoms, and a rapid influenza test will be conducted, which is a swab sample from the back of your throat or nose. Symptoms of the flu include fever, cough, sore throat, runny nose, muscle or body aches, headache, and fatigue. Since this is a virus, antibiotics will not help treat the illness and should be avoided at all costs. So antiviral drugs are the treatment of choice, which includes Tamiflu and Relenza. And these are oral medications that are taken to treat and also prevent contracting the flu. So there's a lot of mix-up with people between how you know if you have a cold or the flu. So this picture depicts key differences between the cold and flu. So the flu has a really abrupt onset, and the common cold has a gradual onset. The flu, your fever will last around 3 to 4 days, and the common cold, the fever, chills, and headache are rare. It's more of like a head cold. And then with the flu, the headache, chills, fatigue, and overall body weakness and aches is common.
Okay, so Shannon just mentioned the flu, and now I'm going to be talking about pneumonia. Pneumonia is another illness that occurs very heavily during the winter months, so it's especially important to learn about the symptoms now. So according to the National Heart, Lung, and Blood Institute from the U.S. Department of Health and Human Services, pneumonia is a bacterial, viral, or fungal infection of one or both lungs, causing the lungs to fill up with fluid or pus. So I have a picture right here to help explain this. So this picture on the left is what a normal lung should look like. The alveoli, which are the air sacs of the lung, they are normally inflated and full, but notice that they are empty. Then this picture shows what pneumonia looks like, and you can see that it's filled with fluid, which makes it hard for the air that we breathe in to get to our blood, and then therefore the body cannot get oxygen. So this is what pneumonia looks like. So as I mentioned, pneumonia can be bacterial, viral, or fungal, which is a little bit different than the flu because the flu is only a viral infection. And pneumonia, just like the flu, is spread from person to person through coughing, sneezing, and close contact. So this picture shows some symptoms of the flu, of pneumonia, which include a productive cough, which is a cough with some phlegm, a fever, chills and shakes, trouble breathing or shortness of breath, chest pain when you breathe or cough, vomiting and diarrhea, and then in the elderly, so age 65 or older, it may be mild or fewer symptoms than what I just mentioned. And a big symptom of infection would be confusion. So if your loved ones or family members start to say like, hey, like you might be a little confused, that'd be a good time to go to the doctor. So if you start to exhibit any of these symptoms, go to your doctor right away, and they'll do a chest x-ray or some blood work to determine what is causing the infection. And then once they determine the cause, if it is a bacterial infection, you will receive some antibiotics. And if it is a viral infection, you will receive some antivirals. And unfortunately, in the elderly, pneumonia can be especially severe, and it may even cause hospitalization. So it's really important to go to your doctor right away and get treated before it leads to something more serious. So like I said, it may cause hospitalization, and you may even need additional oxygen therapy with like a face mask or a nasal cannula. So in the elderly, pneumonia can lead to serious health complications, especially for individuals who already have heart failure, COPD, diabetes, and a weakened immune system due to chemotherapy. So these complications that can arise is called bacteremia, which is bacteria in the bloodstream. This causes widespread infection throughout your entire body. So it'll no longer be just in the lungs, it'll be your entire body that's infected. And this can lead to major complications for all of your body organs, which is extremely severe and can lead to death. So these symptoms should not be taken lightly, and you should go to your doctor right away. But the Center for Disease Control and Prevention, the CDC, provided some tips on how to prevent the complications and how to prevent getting pneumonia in the first place. So if you get any of these symptoms, make sure you follow your treatment plans from your doctor. So if they prescribe you antibiotics, make sure you take the full course of antibiotics. You want to make sure to take every single pill that they give you, even if you start to feel better, because if you don't take the whole course of the pills, it could lead to resistance in your body. And then it also recommends that if you do get sick, make sure you rest and you stay home and limit your contact with family or friends. And I know this can be a little bit difficult to not see your family and friends, but it's really for your own good and for their good, so you don't prevent the spread of it. And then the CDC also recommends following up with your doctor in a few weeks after you finish all your antibiotics, just to make sure that the infection is all cleared. And then lastly, two most important methods of preventing the spread of infection is proper cough etiquette and hand washing, which is something Shannon and I will be talking about in a second.
Okay, so the first prevention method we're going to talk about is immunization. So I already asked you guys if you got the flu shot, and a majority of you have, so good for you. The CDC recommends that everyone 6 months of age and older should get a flu vaccine every season. And according to the CDC, it takes about 2 weeks for the antibodies to protect your body from the flu after administration of the vaccine. If you are 65 years or older, there's an option to get a higher dose vaccination, which has 4 times the amount of the antigen in it, which is beneficial for this population because you're at such high risk for developing other complications on top of the flu. You should not receive the original flu vaccine if you have an allergy to eggs, because the flu vaccine is grown in eggs and around egg proteins, so it's possible you'll get a reaction. However, if you do have an egg allergy, there's an option for a flu vaccine that is not grown in or around egg proteins. It's recommended to get the flu vaccine by the end of October every year because the winter months are the peak of flu season. According to vaccines.gov, the side effects the vaccine usually cause are mild and go away in a few days, but they include pain and swelling and redness on the injection site, headache, muscle aches, or fever, and upset stomach. There is no live virus in this vaccination, so there's no possible way that you can contract the flu from getting the flu shot. And there are many flu viruses, and they're always changing, which is why it's important to get a flu shot every year, because every year a ton of research is done to see which the 3 or 4 most likely strands of flu that are going to be prevalent that year are going to be, and they make the vaccine based on that. So it's just important to get it every year so that you're protected against the flu that's coming up that season.
Okay, so who in the room knows if they've gotten a pneumonia vaccine? Okay, good, I see a few hands. So the CDC recommends 2 pneumococcal vaccines for adults 65 years and older. There are, like I said, 2 different vaccines. So the first one protects against 13 different strands of pneumonia, and the second vaccine protects against 23 different strands of pneumonia. So that gives you wide coverage, so it's really important to get both vaccines. You can go and get the vaccine at your doctor's office. However, you can't get both vaccines at the same time. The CDC recommends that you wait a year in between the 2 vaccines. However, you can get these vaccines at the same time as the flu shot. So when you go in to see your doctor to get your flu shot, you can ask him about the pneumonia vaccine, and they can give you one of those doses right there. And the good thing about the pneumonia vaccine is you don't have to get it every year. It's kind of a one and done kind of thing, and then you're covered. So it's something really important to inquire about with your doctor, and make sure you get those vaccines. Because like I said, the pneumonia is very serious and it can lead to a lot of complications. And then very similar to the flu shot, some side effects of the pneumonia vaccine would just include arm soreness and redness where the shot was given. So that'll go away in a few days. All right, so after talking about vaccines, we're going to talk about a little bit easier ways to make sure you don't spread infection. So these 2 are really important, especially during these winter months, because as we mentioned, these 2 illnesses peak during the winter months. So the first one I'm going to talk about is hand washing. And I know it might sound silly, but there are actually steps on how to wash your hands. So I have this picture right here which shows you all the steps. These are recommended from the CDC, so Center for Disease Control and Prevention. They recommend wetting your hands first, and then lather your hands with soap. Scrub your hands for at least 20 seconds, which is just singing the happy birthday song twice in your head, or out loud, doesn't matter. And then make sure you get the back of your hands in between your fingers and under your fingernails. Those are spots that people usually miss. And then rinse your hands under clean water for 10 seconds. And then dry your hands using a towel or air dry. So like I said, I know it might sound silly, but hand washing is the #1 prevention method to spread diseases. So you want to make sure that you're doing it correctly with warm water and soap every single time you wash your hands.
Okay, so lastly we're going to talk about cough etiquette. It's super important to know how to cough correctly and where to cough into so that you're not spewing your germs out to other people, which is an easy way to spread. So if you have a tissue, you can go ahead and cough into your tissue and then dispose of it right after you're done coughing or sneezing. You don't want to put it in your pocket and save it for later. And then if you don't have a tissue, go ahead and cough into the crook of your elbow, not your hands. And after you're done coughing, it's important to wash your hands with warm soap and water. Liz just taught you guys how to. And if you don't have, or if you're not around soap and water, alcohol-based hand sanitizer will work. And then you may be asked to put on a surgical mask just as an extra precaution to help prevent the spread of infection. So do you guys have any questions for us? Go ahead.
I always got questions.
Yeah.
They say prevention is coughing. Yeah. All right. How does that? I can understand when you say coughing a tissue and throw it away, but you do this and then there's still that germ there.
Right. But think about if you're coughing into your hands and then you go and shake someone's hand. That's direct contact with something that you just coughed into. So it's thought that when you cough into the crook of your elbow, you're not going to be going around and touching people with your elbow, right?
You're going to be hugging them.
But they touch you. They touch you.
They touch you.
It don't make sense to me,
Right.
but you do hug people.
Yeah.
Right,
Well,
right.
remember we said that when you're sick, I know it's really hard, but
Stay
you
home.
should try to limit your contact with family and friends. So that includes hugging, unfortunately. But just think, in a few weeks you'll be all better, and then you can hug them all you want.
Any other questions? Okay.
Like some of those vaccinations, some of them are pasteurized and some of them are, what's the difference?
Pasteurized. Do you know the difference?
Between pasteurized
And non-pasteurized
Yeah, the
vaccine?
flu shot.
not sure on that question. I'm sorry. Yeah.
Because I just got mine the other day.
Do you know if it was pasteurized or unpasteurized?
No, but my wife had to give me one that was unpasteurized.
Maybe is she allergic to eggs?
Maybe, I don't
That's
know.
probably why.
That I think that's the difference.
I
Yeah.
mean, it's not, in the egg.
Yeah.
mixture.
Yeah. So she might have an egg allergy and she gets the unpasteurized. So because the flu vaccine is grown in eggs and around
people
egg
allergic to it.
proteins. So the unpasteurized one will make her not have a reaction when she gets it. That's okay. That's a great question.
The stomach flu. That, how do people contract it? If you get diarrhea, how do people contract that?
It did. No, it's not stupid. It depends on the virus. There's different viruses that have different ways of transmission. So the flu virus is transmitted through coughing and sneezing. It doesn't matter if you have diarrhea or not. It's just the type of virus that's in your body. Other viruses, like good ones. Virus that has a different mode of transmission. I don't know. There's like droplet transmission, airborne, contact. It just depends on the type of virus that you have. Yeah, so like MRSA, which is a skin infection, that's not going to be transferred through droplet. It's going to be transferred through contact. So if you were to touch the wound or something, then you have the chance of getting it. But the flu is droplet.
So it's best to go to the doctor.
Yes,
Yes.
always.
That's the bottom line.
Always.
Yes.
So it's an old wives' tale that if you go outside, you're gonna catch pneumonia.
No, that's not true. That's
Not
true.
necessarily. No. So like we said, the pneumonia and influenza are both spread by an infected person coughing or sneezing into the air. So it is not cold weather. However, the colder months are when like people get their stuffy noses and they're like blowing their nose more often, and that's how it's spread.
And the influenza also.
Yep.
Yes, they're both spread the same way.
Okay.
Mm-hmm.
What about the different stages of pneumonia? Like, I've had regular pneumonia, then walking pneumonia, and then double pneumonia.
How I mentioned, the pneumonia can affect either one lung or both lungs. So the double pneumonia, that would affect both of your lungs, which is more severe than if it were just to affect the one. And then the different kinds, since pneumonia can be caused by bacteria, viruses, and fungal, there's a lot of different strains of the pneumonia illness. And so those would be the different, different variety of what you caught.
And because the doctor says it walks in stages, or that's why they call it walking.
Mm-hmm.
It usually starts at the bottom of your lungs too, which is where the fluid pools, and then as more fluid comes into your lungs, it starts moving up, which makes it harder to breathe.
How do you know that?
Nursing school.
No, about how your lungs fill up for you to pneumonia.
You can hear it.
Well, you would have some symptoms such as trouble breathing, and yeah, you can hear it. So you might have some wheezing. Yep. So wheezing, and then like I said, you might have a productive cough, which is when you cough and like stuff comes up. Which I know is kind of gross, but.
COPD causes wheezing.
Yeah, that's why. How I mentioned individuals who have COPD, this is more common in them, and it's easier to catch it because you already have lung problems, and because your lungs are already compromised a little bit, it's easier to get pneumonia in the flu.
Okay, I get it. I don't want it, but I understand what you said. Cause a lot of people have that. Well, I have COPD, and I do have that wheezing. And when you say your lungs fill up, I wanted to know.
Yeah.
Yes,
You
of
said
course.
you can hear it.
Yeah, it's important to go to the doctors and nurses, because we have stethoscopes and we can hear like the crackles in your lungs.
Mhm.
So that's one indication how we know that you have fluid in your lungs.
And when you go to the doctors, they'll do an X-ray, which is they'll take like a little picture of your lungs, basically, and they can see the fluid in your lung, and that's how they would diagnose it.
I have a question.
Mhm.
Is there any truth in the fact, as you get older, you do not breathe as deeply as you do when you're younger, because you're not active, number one.
Mhm.
Does that make a difference in how you contact the lung problems as you get older? Is
It
that
can.
why, or?
So as you get older, your diaphragm, which is the muscle that helps you breathe, it does get weaker. And so older individuals typically have a harder time doing like deep breathing and coughing.
Right.
So if they were to contract the disease, they have a harder time coughing it out.
Because I notice myself, I don't breathe as deeply as I used to, and I don't really even think about it unless I'm not feeling well.
Yeah.
And then I notice that I'm not breathing deeper.
Mhm.
And I try to breathe deeper, and it's like, that's not working too good.
Right.
Yeah.
It's
so-
hard.
Yeah.
Mhm.
And it's something that we maybe should practice more as we get older, but we don't.
Right. And that's in the hospital, it's super big when you're in the hospital and whether you have pneumonia or not, they give you that little incentive spirometer. Have you ever seen those? You breathe in, it's supposed to help open up your lungs. And coughing and deep breathing, they're really into teaching that so you can either prevent contracting it while you're in the hospital or not get super sick while you're in the hospital.
So we ought to go in and do that every week stitch, you know, or every now and then to keep us.
Well, even if you're not in the hospital, if you have something like that, it's always good to practice deep breathing. And even if you don't have an incentive spirometer, maybe just a few times an hour, sitting down and taking a few deep breaths and then coughing it out, that really helps expand your lungs and make sure that that muscle stays nice and strong.
Well, that's good, but I do believe that as we keep getting older, we get lazier too. And we don't breathe as deeply, probably as we did when we were a little younger.
Right.
Mind, I said a little younger.
Yeah.
Okay, the fluid that builds up in your lungs, does it cause chest pains?
Yes. Yeah, that's a big sign of pneumonia. When you breathe or when you cough, you might feel some chest pain. Just because there's so much pressure in your lungs, so that's a huge indicator to go to your doctor.
Yeah, when I had pneumonia, my back hurt really bad.
Yeah, sometimes body aches is also a sign of pneumonia. Any other questions? Okay, well,
Can't think
Oh,
of
I
it.
do have another.
Okay.
Okay.
Everything y'all talk about, everybody talk about has to do with 65 and over. Why is that?
We're old.
That has just been like the determined age of,
The statistics.
yes.
After you pass 65 and past, your body is susceptible to catching all this stuff that.
Well, not all the time. It's younger people have it. But when I was a nurse, there was a bunch of
It's
kids.
just a more vulnerable population.
bunch of young
so
adults.
It's 65 and older, and infants are super vulnerable too. So yeah, so they're really susceptible to disease. It's like just kind of the opposite ends of the spectrum.
I wanted to ask that question.
Yeah.
You good? You joke about the little people.
Yeah.
All right, so we do have a few activities for you. We have a matching game, and then we also have a flu and pneumonia crossword puzzle. So we thought that we would separate a little bit. We can do the matching game on this table, and then the crossword on this table, and then we'll swap. All right, so then we'll bring the matching game to you guys, puzzle to you. Want to set that up? Okay.
So Diane, she
We'll
wants
do
to come
two
to her.
separate.
We have this.
Okay.
Thank you. Diane, you want to stay for this, or you want to go with Clark? Dennis is here. Do you want to?
You know a crossword?
Turn your chair.
Yeah.
I'll say.
Here, I'll put it here just in case you decide.
I told him just give it back.
We're gonna pens.
The walkers back there.
So have you guys ever played the memory game? Yeah, you just flip them over and try to find the matches. Yeah, you gotta remember. That's the trick.
We're gonna get you some pens.
We got enough players?
You got enough players.
I'll set this up in just a second.
Alright, I can do that.
You just stay
Alright, who wants to go first? I'll set it up for you
You told me
two
you
too.
was gonna stay.
You wanna go first?
Yeah, what do we do?
Okay, so you pick two cards,
stand,
just
Paul.
flip them over,
Okay.
Okay.
alright? So, yep, keep it right here.
He likes to help.
This way or?
Yep, so you gotta show everyone, and then pick another one. Okay, yep, keep that right there. They're not a match, right?
No,
Two different pictures.
right.
So you flip them back over,
that they can pass out.
Okay.
and then
Somebody else
Floyd,
is
you
first.
can go. So whoever has the most matches wins.
It's kind of help work it up.
I don't remember, but I'll do it.
Yours doesn't match
Oh,
either.
let me turn your chair around.
All right, we'll try again. Whose turn is
I'll
it?
teach you guys, I'll help you out.
Your turn. All right, so you can flip over too.
Let Doug help you.
Do they have pencils?
Yeah. Yeah.
I have glasses, I still can't.
Alright.
That's like, mine is last year.
Nope, not matches.
No match. Okay.
Perfect.
Okay. You wanna go ahead and go first? You wanna go
They do?
first?
Well, we're
Okay.
supposed to
So
remember
pick
what
two
we're
cards
doing.
and flip
Yes.
Oh.
That's
Keep
the
them right,
memory
right
game.
where you pick them up, okay?
Look at that. Okay, so now you
Yep,
get
so
to take
set them
these
down.
and you can put it right over
They're
here.
not a match,
That's
right?
your match.
Working on the vowels.
Alright, so we
Now
flip
it's your
them back over.
See the guys?
And then you gotta remember where those are, so when you see the
It's
other
okay, then
matches, you
just
can get them.
pick over two.
Okay? And whoever has the most matches wins.
Perfect. No, you're fine.
No
All right,
match.
I got you guys.
No match.
See that one?
Here we have some markers.
Water.
There you go.
You gotta put it back where you got it.
And the flu. Nope.
Okay.
Alright.
Here's a
Your
marker
turn.
for
You
you.
wanna pick two
Sorry,
cards
guys,
up?
Miss Davy.
Oh, I
All right,
just
John.
Our coordinator, and she.
Turn it
Yeah.
over.
Turn it over.
Gotcha.
Alright.
And pick
And
another
one
one.
more.
Pick another
Looks
one.
like you found pneumonia
Anyone.
over there.
Yeah.
That one?
Yeah.
Alright. No match.
No match.
My boss said.
Alright, go ahead.
Fill the shoes.
Did you flip over too?
Alright.
Tell me
We
where
did
they
see
at.
that one somewhere
I
else.
found them there.
All right.
Remember where?
What are you gonna
Remember
flip
when you say
over?
another one?
Okay.
She moved.
Yeah.
Remember, you got that one
Didn't we see
last
that
time.
somewhere
Yeah.
else?
Thank you for your
Ah, that was close.
No. Did you see what that was?
That's hand.
Okay.
It's my turn.
Alright.
I think it's Floyd's turn.
All right, that's yours.
Alright, good job. You get to keep them.
Can't see.
Alright, you got one match.
Oh, crap.
Close.
Remember it.
That's nowhere near.
Alright.
Okay,
Alright, it's your
Joan.
turn, Joan. Okay? You wanna
Alright.
pick two cards?
There is,
This
man.
Alright, you got some water.
Alright. What other one do you wanna pick?
Okay.
You wanna pick one from right here, Joan?
Check.
Any one of these cards, okay?
Pick another one, Joe.
Okay.
Alright.
No.
Pick one. Joe.
You
Pick
wanna
a
pick
card.
one?
Not quite.
Which one you want?
This one?
Like that stuff that you need.
Yep. Alright.
Alright,
No
Floyd.
match.
It's your turn.
They're germs.
in there, I think I need some.
Alright, go
There's some
ahead.
matches in here.
There's sticky stuff in
Go
there.
ahead and pick two.
Snowflake things, but I saw everything challenge.
Well, then you can two random ones. Maybe you'll get lucky.
Oh, okay. One of the ones I remember well.
What's that one? Oh, it's this little boy.
Yeah.
No match.
But I need to
Alright.
see if I can.
Okay.
It is real small. So I'm lucky you could use those.
Look at that.
Those
Good
types
job.
of things that
It's
we
our
could
turn
use
again.
those.
Oh,
Go
it's
ahead
your
and
turn
pick
right
one.
over here.
Brown construction paper and then just start.
We'll go back.
Or we could use
Wanna
brown.
pick that one?
brown,
And what other one?
Those things.
It's pneumonia. I think you looked over that one before.
Yeah.
What? Pick one more card.
Let's try that one.
That
Put it
one?
back over here.
No.
So that's what it
Oh,
is.
man. Didn't get it.
That's an antibiotic.
Antibiotic.
Okay.
All right,
Wash your
go
hands.
ahead.
Could it be? No.
All right. Pick one more.
I can help a little bit.
That might be
Are you
hard.
sure?
Little boy.
Okay.
Sick little boy. No match.
I think
Nope.
that was somewhere
All right.
over here.
Yes. But I did tell she.
Look at that. You got your match.
We saw him
Let's go.
So yeah.
Antibiotic.
I did it.
All right. Pick a card, John.
If you want to point, I can help you. You want this one?
All
Okay.
right. What other one?
Ah, close.
Picking up.
Okay. Floyd, are you sure you don't want to go?
We have red plates.
I think I know where a match is.
Look at
Hey,
that.
she got it. She got a man. Hey.
All right, Paul, your
Oh,
turn.
you got it. Look at you.
Print off a star.
You're good at this game.
Sick little
All right.
boy. Ah, man, we didn't get it.
I think
Go
I remember
ahead,
what
sir.
he had. Open it on the
Over here?
Yeah. Here.
Yeah, good
All right,
job.
what's that one?
All right, Joan, it's our turn. Again. All right, go
I think you already
ahead and
picked
pick a
that one
card.
up. Why don't you try something down here?
Yep, one card.
Alright, so
Not
current
that one?
stock.
All right,
No, not that
pick
one.
another one.
That's tissue.
What other one do you want to pick?
Whatever they look like.
This one? And what other one? Go ahead and point to a card.
Well, that was not that one.
Point
That
to
one
one.
for that,
Week is at the top.
like the,
This one?
Oh, you did it.
You know where that one's at?
Good.
I got another pen.
All right, go ahead, Paul.
Oh, Floyd, I think it's your turn. I think we got a little out of order. You want this one? Okay.
We did all.
That's the antibiotic.
Right here?
Antiviral? No match.
Are you sure it's not that one?
Good try. All right.
Yes.
This one?
Mm-mm.
Oh, look at that.
Okay, there you go.
All right.
Good job. All right.
Okay, that's
it's our
the water. I remember seeing that one.
Turn. Go ahead and pick a card.
Yeah, I think it's right over here.
Yeah,
Not
they're
quite.
playing it too.
Yeah, we're playing it too.
There you go, Joan.
Pick one of these, Joe.
All right. Okay.
All right. What
All
other
right.
one?
I think that's somewhere right
Right
around
there.
here.
Right
Pick
there.
one more.
Nope, back up. Yeah.
That one?
Oh, look, it's you. That's
No
yours.
match. Bye.
All right, Floyd.
All right.
Okay.
Go ahead.
If you
Paul.
want any of these, I can help flip them. I know they're a little far from you.
Pneumonia,
All right, the tissues.
antiviral. Good
Oh, you
try.
guys gonna help each other out?
There we go.
Oh, that's a
Good
match.
job. All right,
This
Joan.
is pneumonia. These are the lungs and what
Go
they look
ahead
like.
and pick a card. 2 cards. You want to pick this one?
Here,
And
it's
this
a match. We gotta flip this one back over
one?
though.
That one? Yeah. Yeah? All right.
Nice.
Look
Okay.
at that.
Floyd, you
got
can
the
go
match.
again.
Okay, Paul, you got the last.
You got the last one, Paul.
Which one do you want to flip?
Good job. You got it.
This one?
Woohoo! All right, let me get you guys the word searches.
It's some water.
That one.
This one?
Yeah.
I think it's somewhere around here. All right, your turn. You want that one?
Let me get you
All
some
right.
pens, okay?
It's a
Do you have more
antibiotic. It's
markers?
a shot.
Markers?
Those tissues, they keep coming up.
Oh, I didn't see them there.
What do you got there? Oh, Floyd kept turning that one over. Close. It's this one. Okay. You are right. Good job. There you go. There's another one. All right.
Ready? We're gonna do this word search together.
I remember seeing that water. I think right around here.
Let's see here.
Yeah.
Yes.
Look at that.
Flu and pneumonia.
All right.
Oh. Look at pneumonia. Right here.
Are those tissues again? Okay. Why don't we try somewhere around here?
Can you find any words, Joe?
Oh, you got it.
Look.
Good job. All right, Floyd. You don't have many choices left.
I don't know what those pictures
I don't either. We're gonna have to flip them over to see. Which two do you want to flip?
You see, look at sneeze.
too close to
These two? Let's
Yep,
see. Wow.
pneumonia. We got it.
This one?
Yeah.
What else can we find?
Oh, okay.
Cough.
Oh. Which one? This one?
Do you see, Joe?
Good job.
Do you see
All right, now you got the
antibiotic?
easiest one.
Can you find
Last
antibiotic
one.
on here?
They gotta be matches.
It
Better
starts
be.
right here.
There you go.
There we go.
Yep.
All right, good job, guys.
See?
Do you want some crosswords?
Where you going, Doug?
Antibiotic.
Huh?
Okay, I'll get you some.
How about?
All right.
You gotta ask us, you can't go.
Oh, that's what that is. That's what that is. I got it.
You ain't got to do all that.
I ain't doing that. I don't wanna work you to
It
death.
is.
You got your hands full.
Oh, that's all right, Sandy.
Sorry, Floyd. I was calling it the wrong thing. It's a word search. That's what it is. Not a crossword. There you go. All right. I got you. There you go.